Colorectal cancer generally starts as a polyp in the lining and then invades into the wall and then spreads via the lymphatics of the lymph nodes. And that generally correlates with the staging. The earlier stage cancers would be ones that are limited to the wall. And the more advanced stages of cancer is if it's in the lymph node or has spread beyond that. And so usually the earlier it is, the more favorable it is. What we call the concerning signs or red flags would be if there's new onset bleeding, that'd be concerning. Any changes in bowel habits, and then any abdominal symptoms, although that tends to be more in advanced stages. And any strong family history is important to know about because it makes us worry more somebody who has a strong family history of colorectal cancer. And generally I would approach the physician to be referred for a colonoscopy. And that's usually the gold standard to evaluate and diagnose these issues. There's been an increase in the rate of colorectal cancer in younger patients, specifically meaning patients under 50 years old. And that's most notable in cancers of the left colon and rectal cancers in particular. And so because of that, the screening guidelines have changed where now the age to undergo a screening colonoscopy, what that means is a colonoscopy where you don't have any symptoms, is age 45. And the idea is to try and catch people earlier, to try and address these problems before they become cancerous, and if they become cancerous, diagnose them at an earlier stage, which means that it has much better outcomes. Somebody who gets diagnosed with a colorectal cancer, the first thing we do is we have to get some scans. And we get CAT scans of the entire body, make sure this has not spread beyond the area where it started. And there are times we get other tests, like MRIs specifically, and those MRIs usually look at a more localized area at a greater detail, whether it's the pelvis or the liver, for example. There are occasions where we also get a PET scan. We do blood work as well. That helps us get a general idea of the stage of the patient, and based on that stage, we can determine treatment options available to the patient. We have a navigator who will then direct them with both scheduling everything in place, getting all the documentation, all the records, and then being able to be seen and evaluated, and then move forward with treatment. Another thing we do refer young patients to specifically is genetic testing to ensure this is not something that's inheritable that may alter the way we manage it. For colon cancer in general, it is surgery first, and that's usually the treatment, and that's the curative treatment with additional therapies. For rectal cancer, generally surgery is the last treatment, and particularly if it's an advanced stage, with other treatments to try and, we say, shrink it down, downsize it, etc. Having a healthy diet is very helpful, meaning having a diet that's high in fruits and vegetables, foods that have high fiber content, and potentially avoiding excessive alcohol usage. The earlier screening guidelines have certainly led to patients being diagnosed earlier before they're symptomatic and allow those patients to undergo treatment with a much higher success rate of cure. Having the expertise to help manage colorectal cancer is important, and I think we provide that expertise here with the many options available for treatment of the patients. And I think just, having access to that should hopefully be comforting to patients.